So we've been reporting throughout the day that the COVID-19 deaths in South Africa have risen by 213, bringing the total to 8,366. So of the new deaths, 25 were in the Eastern Cape, 40 in Gauteng, 31 in KwaZulu-Natal, 43 in the Western Cape, 51 in the Free State and 23 in Limpopo. So more than 8,000 new infections have been recorded, bringing the total number to more than 511,000. More than 347,000 people have recovered, which translates to a recovery rate of 68%. So Dr. Francesca Conradie is a Deputy Director at the Clinical HIV Research Unit at the Wits Health Consortium, and she joins me now. Doc, a very good evening to you. Thanks indeed for your time. So if we look at the numbers, the last numbers were released last night, what are we seeing in terms of the number of infections? It seems the Western Cape has already reached its peak, and we're expecting Gauteng to reach its peak over the next couple of days. Is that what we're seeing by the current projections?
Yes, I think so. I think that we have reached the peak in the Western Cape. I think that the infections are substantially and consistently declining. I think we're pretty close in Gauteng and the Eastern Cape. And other provinces like KwaZulu-Natal will follow within the next 2 weeks. The more rural provinces where people are more spread out will probably have a lower peak a little bit later on. But I do think that we're pretty much at the peaks.
All right. There's an issue I really want to get to before we run out of time. This is one of the crucial aspects. I want to talk about reinfection because currently there's no scientific evidence, I understand, that suggests that you'd have immunity if you're once infected. Talk to us a bit about what we know now. If you've contracted the coronavirus and you've subsequently recovered, do you have immunity from ever contracting it again?
So the honest answer to that is we don't know at this stage. Remember that this virus and the disease COVID was only really discovered, as it were, in December last year. What we know is that the immune system has two routes of attack when a virus infects a person. The first one is the antibody response. And antibodies are pretty easy to measure. We do a blood test and we can count the number, we can measure the level of antibodies. What we know is that more severe disease is associated with a higher antibody level. And if we follow those patients onwards, we see that antibody level declines. But there's another aspect to the immune system that's called the humoral or the cell-mediated response. The T cells, those are the ones that are involved in the humoral response. Much more difficult to measure. But when we do look at it in vivo, so in people, it does look that there's an established humoral response. There have been a couple of cases, very few in the documented literature, of people who appear to have caught it twice. So who appear to have been infected by SARS-CoV more than once. Let's stick to what we do know. And what we do know is that we do have prevention measures within our toolkit. Social distancing, masking, making sure that we don't kiss and hug, washing our hands regularly is what we can do. We can't issue an immunity passport. We can't say if you have had it, you will never get it again and you're safe and you can carry on in the world as if COVID doesn't exist. What we do know is that you need to continue to practice these measures of infection even if you have acquired it.
Doc, the WHO has said that while those infected did mount some level of an immune response through antibodies, you've explained that particular process, but is there any telling what kind of protection that one would have, if any at all? You've gone on to sum it up quite well, but is there any guarantee that there's any level of protection at all?
So on the 3rd of July 2020, the 3rd of August 2020, the answer is not yet. It doesn't appear that people are reacquiring the infection, but we have no laboratory method to confirm. We go back to the old stock standard things, which is make sure that you are observing social distancing and universal masking.
So talk us through again, we're expecting Gauteng, which is the current epicenter of the coronavirus outbreak, to reach its peak over the next couple of days. I mean, there's a generally concern that perhaps not just in Gauteng, but other areas of the country are struggling due to people not subscribing to these non-pharmaceutical measures, which you also continue to speak about. I mean, what would you say from your area of expertise with what we're currently seeing in terms of the behavioral patterns of people?
I think that what's happening now is that almost all of us know somebody who's had COVID, or alternatively know someone who's actually died of COVID. So the real truth and the horror of the epidemic is hitting home. And that, I think, is what often drives people's behavior. This is real. And people, particularly the vulnerable members of our society, the older people, people with comorbidities, are likely to die of this infection. And I'm hoping that general uptake of the non-pharmaceutical interventions will increase. But we're in for a long haul here. Until we've got a vaccine, and conservative estimates have a vaccine being marketed around July next year, we've got to continue with our current method. Lots of fresh air, lots of masks to prevent us spreading the infection any further.
Dr. Francesca Conradie, Deputy Director at the Clinical HIV Research Unit at the Wits Health Consortium. Thank you very much indeed for your time this evening.